So we knew with my husband having Marfan's that we had the 50-50 chance. Um, I didn't do any genetic testing, but I know you can do genetic testing to see if you have that gene. And I know there's ways of making it to prevent your child from passing that gene, but we didn't go that route. We just decided we wanted to have kids and accepted the chance. So we informed the doctors, we did ultrasounds, but they can't really find anything on ultrasounds. So we kind of just had Brighton, our first son, and waited it out. When he became about 2 years old, or walking stage, so I'm sure it was like 18 months, he started walking, and we noticed that his feet were a little bit more flat, and not only were they flat, but they kind of curved downward in the ankle area. So by luck, my sister-in-law told me about Shriners Hospital, and she said that they're a nonprofit hospital that if you apply and get accepted, they can check out as it's an orthopedic hospital. So they wanted to check out, we applied and we got accepted, and we went up there and they did x-rays, and they did see that Brighton's feet were a little bit different, a little bit more flat and curved differently. And at that point we decided they had made braces to go on his feet. And they're little plastic braces that you wear on your foot that kind of comes up a little bit past the ankle. And it just like Velcros on the foot. And then you put the shoe on top of the brace and you walk around like that. Well, I was pregnant with my second son at the time we got these braces, and trying to put the braces on a little boy at that age and be pregnant was a little bit challenging. So I was not, and we didn't go very many places, so I figured if he's walking around the house, I'm not going to make him wear anything. And there's a little bit of guilt that comes with that, because I don't know if that made it more severe. But when I talked to the doctors about it, they were like, probably not, because chances are that connective tissue is going to break down regardless. The braces are just kind of trying to help shape the feet the way they're supposed to be shaped. But I think that life is just going to kind of make it happen the way it's going to happen regardless. So I didn't push the braces very much, and Brighton's feet have gotten continually worse and worse. From there, we were actually told about a study that was going on over at Primary Children's Hospital, and it was a study for atenolol versus losartan, which is blood pressure medication, and they were studying it in Marfan's patients because they wanted to see if a child was put with Marfan's was put on blood pressure medication, if that would help the enlargement of the aorta as the child grows. If the goal is to have not as much blood pressure going through the heart, and that way the heart doesn't stretch the way it would stretch if that blood flow was just doing its own thing. So we were able to get both the kids on this study, and therefore we would go up to Primary Children's. We would do Holter monitors for the kids, echocardiograms, and of course the medication, but it was a study medication, so we didn't know which one they were on or if it was just not a medication. So we did that for 3 years. And when they did the echocardiograms, they both have enlarged aortas, and that was basically the determining factor that they both have Marfan syndrome. And I think my youngest son was about not even a year when he was diagnosed, and my older one, they're 2.5 years apart, so he was probably about 2.5 years old when he was officially diagnosed with it. So we got a lot of help that way, because having Marfan's and having 2 kids affected with Marfan's can become a little bit financially of a burden. And echocardiograms are not cheap, and then all the Holter monitors and everything else can be, expensive. So felt very blessed to be able to get them in that study, follow them for 3 years, and see how the heart was changing. And it seemed like the heart's been steady. It hasn't been changing much. And I think in early stages of Marfan's, that's generally kind of how it goes. But everybody's different, so you don't know who's going to be more severe or not.